move on to the third ECG changes. So very beautiful picture, So on to the left, what you see, on to the right, what you see. On to the left, what you see is a diffuse ST elevation. You see there's no territorial involvement at all. One AVL, one is showing, 2-3 AVF is showing, and you have V4, V5, V6, V2, V3. So everywhere there is ST elevation. And they are concave upwards. If you notice this elevation, they are concave upwards. Okay, like this. They are concave upwards. Okay, and the T waves are upright. So it's like a smiling. So this is more benign, okay, not like a acute myocardial infarction. So that's what it implies. Okay, so the earliest ECG finding that you get in acute pericarditis is PR segment depression. PR segment depression in all leads except AVR. In AVR, what do you find? PR elevation. Okay, so that is the earliest ECG sign, and it reflects the pericardial inflammation overlying the atria. Okay, so classically the ECG changes are described in 4 stages. The first stage you have PR segment depression or ST elevation. The second stage where you have normalization of this ST. Third stage is where you get T inversions, and fourth stage is complete normalization of the ECG. Okay. See, technically speaking, pericardium is electrically silent, electrically inert. Okay. So whenever you have this ECG changes, it means that there is concomitant myocardial involvement. Okay. So classically, this ECG changes are seen only in 60% of patients. 60% of patients only have this classical ECG changes. Clear? So the right side of the image where you see this is ECG suggestive of acute myocardial infarction. Which infarction? Anterior myocardial infarction. Okay, you find ST elevation in one AVL, V1 to V4, V5. In fact, V5 also shows ST elevation. Okay, here it is localized. Only anterior territory is showing. Inferior territory is in fact showing reciprocal ST depressions. Okay, reciprocal ST depressions. And it is convex upwards. You see, these are ironed out segments. They are convex upwards like this. So that's why this bad smiley is put here. It means it's a very dangerous thing and it needs immediate treatment. Okay, and the T waves can become inverted. Clear, no? The ECG features distinguishing acute pericarditis and acute ST elevation MI, they both are different, very easy to recognize, and because you will have to recognize as a physician because the management is completely different. Okay.